This video presentation centers on meaningful collaboration and healthcare leadership. Delivering safe, quality, compassionate care is the primary mission of any healthcare organization. The information provided in this video can be utilized as a learning tool for all healthcare professionals. As healthcare professionals enter the work environment, it's more important than ever that they work as a team. True collaboration means a work culture where joint communication and decision-making among all team members has to become the norm. That culture requires skilled communication, true collaboration, effective leadership, and most importantly, meaningful recognition. The healthcare organization and the individual team members must share equal accountability for creating a collaborative culture. In order for meaningful collaboration to be effective, teamwork in action must take place. The ability to ensure patient care is determined not only by advances in medical technology, but also by the leadership effectiveness of all those involved in patient care. These individuals are leading patient-centered experiences as they foster new methodologies for working together. Therefore, effective care depends on collaborative teamwork. This is extremely important amongst physicians and nurses.
Teams offer the potential to achieve more than any person could achieve working alone. To capitalize on the benefits of teaming, certain knowledge, skills, and abilities are needed. Collective learning is essential and can be achieved through collaboration among team members. Individual learning behaviors within a collective learning experience include asking questions, sharing information, seeking help, experimenting with unproven actions, talking about mistakes, and seeking feedback. Reminding staff of these steps enable groups to obtain and process the data needed to improve. Leaders can improve upon the teaming efforts by creating environments that support and encourage sharing, especially the sharing of mistakes, because the greatest potential for learning comes from errors. In healthcare, organizing to learn is more important than organizing to execute because the path forward is not always clear. When hiring new staff, healthcare organizations would benefit from hiring problem solvers and experimenters rather than conformers. Also, employees should be taught tasks while performing them rather than learning ahead of time. When measuring performance, employers should focus on whether or not information was learned rather than if the task was completed correctly. Other suggestions include experimenting through trial and error and improvising. Organizing to lead allows organizations to learn faster than competitors and to improve processes more quickly.
According to Edmondson and Shine, the activities of teaming, taking risks, confronting failure, and crossing boundaries are anything but natural acts in large organizations. This means that leadership is now more needed than ever before in today's complex, constantly changing landscape. Leaders are needed constantly with the evolution of technology in healthcare. Collaboration of doctors and nurses are needed, in which creates effective learning through meaningful collaboration. Doctors are leaders in their profession, in which helps nurses and other specialty personnel learn their profession and objectives in the field. Facing the many technological and geopolitical transformations reshaping the workplace, many leaders struggle to grasp the realities of teaming and continuous learning as a way of life. Some are acceptable to change and others do not believe in changing at all. Inevitably, change will happen, and the purpose of having new leadership styles in this environment is due to the reshaping of the industry. Innovative ideas are happening every day, and the same as leadership developmental styles. Leaders are now adjusting and learning new ways to lead because of changes in the industry and competitiveness it is creating. According to Edmondson and Shine, today's effective leaders differ from even the most successful managers in yesterday's routine-intensive organizations. The difference starts with a basic mindset about human beings, whereas industrialization essentially infantilized workers. The knowledge-based economy only works well when it restores workers on all levels to self-respecting, self-determining adulthood.
Industry may present many unseen challenges that will require unprecedented ways of doing things. Healthcare needs people who are dedicated and passionate about the patients and healthcare in its entirety. The healthcare industry is full of opportunities where people can strategically think and plan for a better way of accomplishing healthcare quality. Seeking ways to advance healthcare is a challenge that necessitates innovative ways to advance the care of patients, streamline the workflow that produces an effortless flow that requires much planning, strategizing, and creativity. Innovation is the key that undergirds and impacts the quality and cost of healthcare. Never be defensive when it comes to new experiences in the healthcare world, but remain steadfast and know you have touched someone's emotion, which is vital to any success. Today's leaders must build a culture where teaming is expected and begins to feel natural, and this starts with helping everyone to become curious, passionate, and empathic. Curious in the sense that they find out what others know, what they bring to the table, what they can add. A key tension that people face at work is the tension between the need to deliver and the need to discover. The need to deliver on promises and obligations, and the need to discover new ways of doing things. Both are important, yet they can pull us in opposing directions. The goal for leaders is to have the staff curiosity, which helped others deepen their own understanding of the organization's processes and results. Passion fuels enthusiasm and effort. It makes people care enough to stretch, to go all out. Passionate involves tapping into the inner drive or purpose that makes individuals want to go above and beyond. Leaders need to use the passion of staff to drive the direction and outcomes and work together, something that truly matters to them. The possibilities of these also being shared goals or causes are even greater, resulting in shared passion. Empathy is the ability to see another's perspective, which is absolutely critical to effective collaboration under pressure. Empathy is a foundation for productive communication and relationship building. Teaming can guide employees towards examining and identifying their emotions and those of their teammates in order to relate their perspective. Leaders have to have the ability to team understanding the need to grasp the many sides of today's complex problems and the capacity to collaborate with others to solve them. It means being as good at listening to the ideas of others as articulating your own. It means being able to lead a team one day and participate as a team member the next. When teaming in today's environment, you need natural instincts that allow you to tackle these challenges. When you are concerned about yourself, you tend to be less interested in others, less passionate about your shared cause, and unable to understand different points of view. So it takes conscientious work to shift the culture. So the idea behind teaming is to create a culture where these tendencies are reversed and teaming for today's environment happen effortlessly.
We hope this video presentation has been insightful and also can be used as a learning tool for all healthcare professionals seeking new ways to find meaningful collaboration and healthcare leadership.